In part 4 of our investigative series, The Kids Are Not All Right, we look at solutions. All this week, we've been telling you how kids are struggling in the classroom with things like anxiety and a lack of emotional well-being after being isolated at home for so long during the pandemic. So we've heard from counselors, teachers, medical professionals, the school principal, and the BCTF who all say the same thing. The education system needs more money and way more resources. Now, the teachers union says every chance it gets, it brings up this topic with the province, but is surprised more money was not dedicated to education in this year's budget. The province, for its part, is investing billions and putting more than $160 million toward helping teachers, teacher psychologists, special ed teachers, and counselors. Now, one doctor with the Vancouver Coastal Health Authority we talked to says many of the mental health concerns we're seeing among young people right now started pre-pandemic and have only worsened. Adding more money would get people help and ease the burden on the overwhelmed healthcare system.
I try to be pragmatic and be honest about the fact that things will cost money. But the root of this, the reason we are advocating for this and the reason we hear it is we hear this from members. What you're hearing a little bit of in my voice, we hear from members all the time. And that's that emotional wear, that emotional drain, the memory of students that you wish you could have done more for. Yeah, you can't articulate it unless you're there, but I hope people know that that's the driver for the things we ask for, is those things. It's not about money. It's about making sure that their children have everything they need. I absolutely have students that I know I could have done more with if I had the ability, the time, and the resources to help them a little bit more. And that is a crushing feeling that you don't forget.
Are you frustrated?
Yeah, I mean, I think it's fair to say frustrated is a thing, and it's hard because, like I said, I do understand. I understand how governments work. I understand how taxation and prioritization and the things that have to be done. But at the end of the day, when you're talking about children and the start you're giving them in their life, yeah, I am frustrated. I think it's time that education was seen for the priority it is. And brought back up, like I said, to those levels of the early 2000s. And you'd have quite a different system. I won't lie that this budget year was one that was quite surprising. Understandably, as I said, health, and I support 100% everything that's happened in terms of addressing health needs, because the pandemic, like I said, highlighted a lot of things, and we all know. My family doctor is still in Chilliwack, an hour and a half away from where we live. So I appreciate the prioritization of health that's happened. But we're not out, but we're on our way out, and we're in what I would call a kind of a recovery from COVID mode. So we did think that there'd be a higher prioritization on education in this year's budget. So yeah, it is getting to be a bit of a long wait.
So, I think part of the solution and part of the reason that public health was so passionate about this during the pandemic was during the pandemic, we really felt that keeping schools open was a key priority for keeping them safe and connected. And, I myself am extremely thankful for the partnership and hard work and resilience and commitment that was shown by schools and districts and staff and students, parents and caregivers during the pandemic that really allowed us to keep schools open. I think we feel very proud that BC had the fewest weeks of closure during the pandemic across Canada and among many jurisdictions. And really, that's a reflection of the hard work of all of those groups. And we're really, really thankful for that. Going forward, I think that one of the important things is to make sure that we're not focusing solely on really the downstream measures. So, when we think about what's keeping kids well and what has been really damaging their mental health, we think about things like, again, sleep, physical literacy, physical activity, healthy eating, social connection. Those are really the things that are falling apart. And I think there's a temptation when we look at how to address these things to just jump to treatment. Where's the medication? Where's the hospitalization? And I think it's actually really important to keep in mind, what is the root of the problem? We have this parable that we often tell in public health called the parable of the bridge. You might have heard it. It's basically a parable where you imagine you're standing at the shores of a swiftly flowing river and you hear the cries of a drowning child. So, of course, you jump into the river, you pull the child to safety. But as soon as you do so, you hear the cries of another child. So you jump in and pull them to safety, but then you hear the cries of another, and you keep on jumping into the water until you realize that upstream of where you're standing, there's actually a hole in the bridge that's causing kids to fall in. And I think the problem is if we jump right to mental health treatment and medication and psychiatric care, which are extremely important, but we don't actually address the hole in the bridge, kids are going to keep on falling in. And so, it's really important that we have address things like, again, mental health treatment and medication and psychiatric care, but we also address things like physical activity, healthy eating, sleep, social connection. And that's what we're working on right now with our schools and our municipalities and our partners in the community. So when we say upstream, we're talking about things that are actually causing the problem. And when we talk about downstream, we're talking about the things that you need to address the immediate situation. So, we talk about, mental health treatment, psychiatric care, putting kids on medication, and that's for kids who are already, unfortunately, quite far in their mental health journey, where they already have potentially a diagnosed condition. But we also have kids who are further upstream in that process. So they're actually, they don't have a diagnosed condition yet. Things have not gotten to an extreme level, but they're experiencing a lot of the risk factors that, if unaddressed, will lead them there. And so what we're saying is it's really important to address the continuum, not to just put a Band-Aid on the downstream, but to also address the things that are upstream and make sure that those kids who are experiencing risk factors but don't yet have disease are part of the target group too, that we're addressing, the things that are leaving them at risk. Again, things like, poor social connection, poor sleep, poor physical activity, not eating well. Those are the things that we also need to address alongside the kids who already have a diagnosed mental health condition.